Good afternoon, viewers, and welcome to the second edition of the program Health and Wellness is reaching you on Leadership Television. As you can see, I have my guests, my people, same as last week in the studio. My name is Winifred Webo, and the doctor in the house we have with us is neurosurgeon Dr. Ubongg Essien.
Thank you, viewers. Happy to be here again to discuss some very important health issues.
Yes, and my co-presenter, Patience. Patience Hejurika. Patience, it's a
Good
pleasure.
afternoon, viewers. Good to see you again today.
Yes, as we stopped last week, we were talking about diabetes symptoms and management. You know, doctor, you were talking about the lifestyle modalities to adopt when managing diabetes. And that was when we stopped last week.
Okay, yes. Well, maybe just for viewers who were not able to catch up,
Yes.
I'll just do a brief summary of what we discussed last time. We started by, first of all, defining what diabetes is, diabetes mellitus is. And the definition we took was that of the American Diabetic Association Guideline 2009, which defines diabetes as a clinical or metabolic condition in which you have persistent hyperglycemia, in which the fasting blood sugar is more than 6.9 millimoles per liter, or 2 hours postprandial that is more than 10 millimoles per liter, or random blood sugar of more than 10 millimoles per liter in the presence of features of hyperglycemia, which we mentioned: polydipsia, polyphagia, and polyuria, which I think I tried mentioning. Polyphagia, eating of plenty food; polydipsia, drinking of plenty water; and then polyuria, passing of plenty of urine, usually more than 2 liters in 3 liters in 24 hours. Okay, then we also said that it affects virtually all the organ systems, and we tried,
Yes.
itemizing
Each.
each of the systems, what it affects. We talked about the central nervous system, which can cause blindness, can cause cataract, can cause glaucoma, and then we went down to erectile dysfunction when it affects the genitourinary system. We also talked about affecting the cardiovascular system. It can cause hypertension, it can cause myocardial ischemia,
Ulcers.
it can cause gastroparesis. So we mentioned a lot. Talked about even it can give you numb sensation, it can give pressure, diabetic foot ulcers, and we mentioned all the various systems and the complications that can occur following uncontrolled diabetes. I love mentioning the word uncontrolled, because if the diabetes mellitus is controlled, most of the complications that arouse the disease usually might not occur. They only occur when you have them uncontrolled. We also talked about the different types: type 1, type 2, and gestational diabetes. So that's just in a nutshell for those who are not able to catch up. So today, we've laid a good background about the disease and the types and then the effects. It doesn't matter to us. What matters to the public now is how do we treat, how do we prevent it. And then we started by saying that the treatment would depend on how the individual presents, whether it's coming as an emergency, and we mentioned diabetic ketoacidosis, we mentioned hyperosmolar state. Those ones are emergencies. In those emergency situations, you just want to first of all resuscitate the patient. We now move to the cold cases, those that come to you, they are okay, those that they just realize that they've been passing plenty of urine, and then they have had tests done that shows that their sugar is very high, persistently high. So for those ones, we have what we call lifestyle modifications, we have medical treatment, and then those that have surgically related complications, surgical treatment. So let us start with the lifestyle modifications. We talked about the lifestyle modifications ranges from diets to exercises to things that must be avoided. So let me start with the diet. Well, I'm going to start with the don'ts of the diet. things you must avoid include alcohol, include excessive use of refined sugars, include cigarette smoking, include reduction in fatty diets. So you want to reduce the things I had mentioned. You want to reduce alcohol, you want to reduce cigarette smoking, you want to reduce the consumption of unsaturated fatty acids in the form of vegetable oil. We prefer palm oil. Then let us go to the kind of food you eat. In the morning, your breakfast, we would prefer a meal that has these three uh, macronutrients: carbohydrates, protein, and vegetable. So you have a plate of food before you. You divide the plate into two. The first half, carbohydrates. So let's take an instant, some piece of yam or a sizable amount of rice. And then the second half of the plate should be divided into two. 50% protein and then 50% vegetable. The reason why we put vegetable is that it helps to reduce the amount of carbohydrates you're consuming. So it fills the stomach. It fills and gives you that high sense of satiety. And so you won't need to consume a lot of carbohydrate. So you have plenty of vegetable in forms of maybe vegetable leaf, large chunk, mixed with some tomatoes, and then you now have two or three pieces of meat or two, three pieces of fish. And then for your lunch, you also divide the plate again into two. For those that love taking eba, so you divide into two. The first half is the carbohydrate, which is eba or semo, should be about the size of your fist, not more than the size of your fist. And then the other half, you divide it
Even
again.
for adults.
For adults, I'm talking about here. Yes, I'm talking about for adults. Yes, so it should be about the size of your fist, and then you divide the second half again into two. The first half, large chunk of vegetable, and then two or three pieces of fish in the last. So with that, you have a balanced.
But doctor, are you saying that no, they should not eat? Your food should not be filling, because I'm just imagining eating.
Just a size. Most of what we want you to be taking is that vegetable, so that it can fill up.
It's not filling.
It does.
Is this for those already having diabetes?
Yes, those that already have diabetes.
Or those are normal?
Those that are normal, prevent those things I mentioned. Don't take alcohol.
Okay.
Don't do cigarette smoking. There are still infections. Remember, I mentioned acute pancreatitis that can, alcoholic pancreatitis that can predispose you. So avoid unhealthy lifestyles that can predispose you to having those things I had mentioned last week.
Okay.
So if
How does the cigarettes come in?
Okay, cigarette. Certain metabolites that are found in cigarettes, nicotine and all that, have been found to cause inflammation of the pancreas. And don't forget, I mentioned it last time that there are certain specialized cells within the pancreas. We call them the beta cells, and their job is to produce insulin. So you destroy those cells, the beta cells of the pancreas,
When you smoke.
when you smoke, when you take alcohol, so those are the things you must try to avoid. That is for those that are not diabetic. And even for the diabetics also, we also tell them you must change those lifestyle. So let's finish the diet so that I can move to exercises and move to other things. Then in the evening, your dinner, we prefer just go on fruits. Pawpaw, pineapple, just take plenty of fruits. And anything beyond 7, just drink water. Now, for those who are going to be taking medications, we'll advise them that as soon as you take your medication, you should have some meal, because we would prefer you have hyperglycemia than hypoglycemia. I'll explain. Hyper meaning high level of blood sugar, high level of glucose within the bloodstream. So we would prefer that you have high level of blood glucose than for you to have low level of blood glucose. The reasons being that the brain, would not survive or undergo irreversible death if it is starved of glucose more than 2 to 5 minutes.
2 to 5 minutes.
Yes. So the brain, because the brain does not have cells that produces glucose. There are certain cells in the body that produce glucose on their own. The brain only breaks down glucose. And what that means is that it's only the glucose you give him that is able to utilize to function. There are some cells that on their own, if we don't give them glucose, they have other alternatives of providing energy for themselves. But the brain is different. Nerve cells, neurons, brain, they don't do that. So if you don't give them glucose within 2 to 5 minutes, you have irreversible brain death. The other things that can cause irreversible brain death, hypoxia and the rest, but with respect to diabetes, so you want to make sure that anybody that is taking anti-diabetic drugs, oral hypoglycemic agents, insulin, must have some amount of food. Because in as much as you want the sugar level to come down, you don't want it to go too low, less than 2 millimoles. Because within 2 to 5 minutes, if the brain is starved of glucose, it undergoes irreversible death, and that leads to clinical death. It is the brain that controls the other parts of the body. So when the brain undergoes irreversible death, it means that person is dead. Okay, so that is on one hand. Then exercise is another thing we also encourage diabetic patients to do. 30 minutes to 1 hour every day. It can just be a jog around your environment. It can just be a trek around your environment. Then also, we also advise them to always look at their legs anytime they come back in the evening. They go out for a walk, they go to walk, their usual walk, they are farmers. Remember I mentioned that they could have what we call neuropathy, numbness of the legs, such that they can even put their legs in fires and they will not know. So they might even get injured without knowing. So what we advise them is that whenever you come back from work, you must take time, expose your foot, and assess if there are any injuries. If there are any injuries, you should have those wounds, cared for in the hospital. Another thing again is we advise them is they might need to change the type of shoes they wear. They should wear shoes in which the outer covering of the shoes is hard. The reason being that if the outer covering is hard, nails will not be able to pierce through. But the inner surface of the shoes, where your leg sits in, must be soft. So you have hard outer sole and soft inner sole. And the aim is to protect the legs from having injuries. Other lifestyle modification is that because it affects the heart, it affects the eyes, we advise them to regularly go for checkups. Have an eye doctor look at.
Sorry, before you talk about a regular checkup, how does this exercise now impact on your well-being? Does it that it regulates the sugar in your system or what?
Yes. So when you're exercising, remember we said that all the cells utilize glucose. So when you're exercising, the myocytes are cells in the skeletal muscles. So they utilize that glucose and then they reduce the amount of glucose that is in the blood. So exercise, fantastic. Regular exercise helps to reduce the amount of glucose that you have within the bloodstream because you require those glucose to generate energy in the form of ATPs that the cells will use for all those contraction relaxation that you do during exercises. So it helps to reduce the amount of glucose you have within the bloodstream.
What about in the issue of insulin production? Does it activate the production?
No, it doesn't. It doesn't. What activates insulin is high level of glucose within the bloodstream. It just sends signals to the pancreas that see, there's plenty of glucose within the blood. The pancreas will now stimulate, the beta cells are now stimulated to produce insulin. So that is on lifestyle modification. So let's now go to drugs. This might not be a good forum to discuss all the various drugs because we're not in the medical class. But what we usually tell our patients is that you must adhere to the instructions of your doctor. Now, one of the things we tell our patients is that beyond adhering is that you must have a notebook where you record your blood sugars, because we usually would teach our patients how they can test their blood sugars. So you record in the morning as soon as you're waking up. Remember I told you that fasting blood sugar is the last meal the patient had was 10 p.m. the previous day. So early morning around 6, as soon as you're waking up, take a small bite and you say, okay, this is 6.2. You record it, millimole per liter, and then you take your drugs. The reason is that by the time you're seeing us in clinic, we want to see how your blood sugar control has been. It helps us to tell us if the dose we are giving you is adequate enough. 2, it tells us if you're even taking the drugs. Three, it tells us if the drug you're taking is fake or original, especially in countries like ours where people produce most of these things and you don't know if you're actually giving the patient the right drug or not. So you want to be sure, because you might be seeing a doctor, you're taking drugs, and yet you still come down with complications. Why? Because you're not taking either the right dose or you're not taking the right drug. You might be taking, an unadulterated medication. That is on one hand. I must also say this: you must always have some cubes of sugar around you, because, as I said earlier on, we prefer high levels of glucose to low levels of glucose. Low levels of glucose will shut down the brain within 2 to 5 minutes. So at any time you start having symptoms of low blood sugar, which are one, you start sweating in the presence of AC, everybody is feeling cold, you're sweating, you start having a feeling of hunger, you start having tremors, you start having palpitation. Palpitation means you start feeling your heart beats. At that point, it tells you that your sugar level is beginning to get. The next thing that will happen is that you become unconscious. Okay, so by that time, we advise you to have your blood sugar kits. You test your sugar. If it is less than 3.2, tilting towards 2, please, we advise you break some cubes of sugar in a cup of water and drink, and then that will bring it up. So that is on drugs. There are certain complications that can occur that will require you to have surgical treatment. I mentioned the other day diabetic foot ulcers. Some of them might require some revascularization surgery. Some of them might require amputation. Some of them might require the eye doctors to remove those cataracts and all that. So that is the surgical treatment, which is beyond the scope of the discussions for today. So those are some of the lifestyle modifications which you had mentioned. We also talked about the drugs. We also talked about, surgical treatment that these diabetic patients might require. To cap it up, is that treatment of diabetes, just like I said last time, it is multidisciplinary. What do I mean by multidisciplinary? Is that it's not just the job of the doctor. You need a pharmacist, you need a nurse. If you have a diabetic foot, you need a nurse that will dress the wound. You need a pharmacist that will dispense the insulin and dispense the other forms of drugs that we give. You need a dietitian, who will tell you this is the amount of carbohydrate you should take, this is the amount of fat you should take, this is the amount of protein you should take, this is the amount of vegetables you should consume. You need, an orthopedic surgeon. You need a surgeon. So it's multidisciplinary. You require all health experts in the hospital. Even among the doctors, you might need a cardiologist, you need an endocrinologist, you might need a neurologist, you might need an ophthalmologist. So it's multidisciplinary. At any given point in time, a diabetic patient should seek these different specialists, as it will help in the management of this patient. It's important to mention that not just one doctor, that knows it all. No. Each and every person in the health has their own role to play.
Okay. You're talking about the patients trying to see all other doctors. Now that we have very few doctors in the system, and somebody is having some problem, how would the person cope?
Well, it's a clarion call to government. It beats my imagination. It's saddening that Nigeria has become a veritable pool of skilled manpower. It's not just doctors. The banking sector is also facing the same problem, brain drain.
Yeah.
The IT sector, they're also facing similar problem. So why would you train a doctor? Do you know what it means to train a medical doctor? Colleagues of mine who train in the US, some of them are still paying the loans they took to train in their medical school. I'm not even talking about the UK. I'm talking about Canada. I'm talking about the US, where you have a liberal economy. So you train a doctor. I don't think my school fees all through medical school. At some point, I was paying 44,000, 30-something thousand, per semester. And then you train a fine, well-skilled doctor, and you send it to the society. Before you know it, because of poor remuneration, lack of jobs, the doctor is already writing exams and is leaving the country. Why? So who treats those the 200 million people that we have in this country.
Yes, there was a report last week by one of the national dailies, Vanguard newspaper, to be precise. It said that Nigeria currently has one doctor to 6,400 Nigerians.
It might get worse.
Whereas according to WHO standard, it's supposed to be
One
one
to four,
doctor
yeah.
to 400.
Yeah, so it might get worse. But I wouldn't blame government entirely for all the issues, because the truth of the matter is that no matter how we want to look at it, we are a poor country. We're in a third world country.
Yeah.
So you need the kind of money the UK invests in health, the NHS, is more than our 10-year budget. 10 years budget. I'm not talking about 1 year budget. 10 years budget. Where would the government get that kind of money from? It's a third world country. So what we can just do is the little that we have now, let us start building small. Because the time will come that we'll get to that level where we can invest that kind of money in the healthcare. Then don't also, in all these things, let us not also forget that even the so-called developed nations, they are still having challenges and they are still growing from where they are. To see a doctor in the UK, maybe a family physician in the UK, it can take you 3 months. It's not this one that you just come to National Hospital or you go to Gogolada, bam, and you're seeing do you know what it means to say medical doctor? Go to the UK and see. So they also have their own challenges. And even there, doctors there are also protesting that the remuneration is poor. And they are migrating on to either Canada or Australia or the US.
It's bad. Now, back to the topic that we are discussing. I want to find out from you. Now, the diabetes cases that you see, would you say that diabetes is on the high, the incidence is high or low?
The incidence is getting worse. Lifestyle modification, lifestyle changes. We are eating a lot of refined foods. People are indulging in more in alcohol. Is there any party you go that you don't see alcohol? You'll see. People are indulging in more cigarette smoking. People are doing a lot of... So as the dynamics of our social lives move from green, as it were in the past, where people were only indulging in the green things, to the Western, definitely diabetes is becoming... We're having more diabetic mellitus patients than we used to have before.
The other thing is the prevalence among children.
Well, for children, remember I had mentioned another way you can classify the congenital forms and the acquired forms. So for children, the congenital forms are usually due to either they were born with an absent pancreas, congenitally absent pancreas, during the development of, during pregnancy, usually in the first trimester, that's the first 3 months. That is when most organs of the body are formed. So if for any reason there's an insult, maybe the mother gets infected with touches. Touches is the infections that affect development of organs. So it can affect the development of the pancreas. So you can either have a poorly formed pancreas or a well-formed pancreas. So if you have a poorly formed pancreas or not even formed pancreas at all, don't forget, it's the same pancreas that produces the insulin that is required. So those kind of children might be born with congenital.
Yes, but in case of maybe malfunction or a pancreas that is not functioning adequately, is there anything you can do to rectify it?
Well, you might not be able to rectify it. All you do is to give insulin. No center has been able to do pancreas transplant yet, unlike you have in renal
drugs
transplant.
That can activate
No, there's none. There's none.
How
So
children are obese?
those that are obese work well. That is the children that are obese. That is the type 2. You ask them to lose weight, do the exercises. If they can't lose weight, you might need to do some surgeries to reduce the amount of food that gets into the stomach. You can do gastric banding. Gastric banding means you have a big bowl of stomach that can take 400 grams of food. During surgery, we cut the stomach and reduce the size.
Yeah, I do watch it.
So the amount of stomach, the volume of stomach now becomes small. So the amount of food the person can consume becomes small. Yeah. Or we can do bypasses. We have what they call gastric bypass, biliary pancreatic bypass. It's beyond the scope of this. Let's not go there. It's beyond the scope of this. So you could do gastric banding, you could do sleeve gastrectomy, you could do, bypass surgeries. It's beyond this level.
Wow, it's interesting.
It's really interesting. Our viewers, our time is up. It's been a very interesting episode. Next time we'll be back here with another episode. I will thank our doctor for coming here this second time on this topic. A neurologist. We really enjoy
Thank you so much.
your time with us. Thank you very much, doctor. We appreciate it.
Thank you.
Bye for now, viewers. We'll see you again next week, same time.
Thank you for watching. For sponsorship and advert placements, please contact 080-3688-6158. Last Word Leadership Podcast Studio. You have the last word.